Soliciting questions, of course, from readers on the coronavirus. But before we get to that, I wanted to ask you a couple things. One is we were just getting ready to come out of phase one. How's it been going in Jefferson?
I think it's been going well, and it's always exciting now with the governor's announcement that we can start phase two. But I think phase one went really well. I think, business owners and residents really understand that we are in a place that we're living with this virus. It is amongst us. You can see the numbers. It's still there. It's certainly plateaued in Jefferson Parish as well, as at a lower level than what we were dealing with. And there's been some bumps in the past couple days, and that might be lab result issues or timing issues, which we never know. But I think, we have to come to the understanding that we're going to have to step out. We're going to have to get back in a phased approach to a normal kind of life with living with the virus, whatever normal that looks like, which is, I always like to say, you always have to play defense. It's always playing defense on this virus. We all have loved ones who are more vulnerable than ourselves. I have my mother. So everything I do during the day, I'm thinking about my mom. I cannot bring this virus home to my family.
And you've had, it's affected your family.
It has affected our family. I'm trying to be respectful, but my extended family, and we've had losses, and it's very tough. I've had to see family members and hear about them not being able. It was at the height of it, not being able to get in the hospital, and I can't imagine how. If I had a loved one, and I love these people as well, not being able to be by their bedside, and let me tell you, the medical community understood. They were calling them twice a day, giving them updates. They were the lifeline for these people's connection to their loved ones. And so it's affected people in a very difficult way. And I always say the people who think, oh, this whole thing's overblown, and this, you do have that.
Absolutely hear that, yes.
Upset. Wearing masks is ridiculous, and
my freedom.
My freedom, and the coronavirus has really brought out the full spectrum of opinions,
hasn't it? Yes.
And I always think those people who get that, it didn't affect them personally, and they think it's a separate thing, because I don't think you can know someone who was sick or have that fear strike through you and not be changed by that. So again, this is like many issues. This has brought out completely different opinions across the spectrum, and we're trying to find the balance.
Right, and you've had some losses in parish government too.
We have had some losses in parish government. We have lost to, our water department has been hit very extremely hard. So we have also had losses. The sheriff's office has had losses. So many employers, and that's your family too, where you work. I'm sure you all think of this as your family. You pull for each other, and you're concerned about each other. So it's been a very difficult time. But.
So the governor made his announcement yesterday about phase two, and in the first phase, Jefferson pretty much followed the state's guidelines. Is that what we should expect? Are the state guidelines Jefferson's guidelines?
Yes, I think to the extent, first of all, I don't have in Jefferson Parish, we don't have a Department of Health embedded in us. So I'm not in a position where I'm getting the modeling. Certainly I can Google, and we're certainly doing that best practices. But I don't have an embedded health unit. And so our health unit is essentially compared to New Orleans, which my understanding is that's the only parish in the state that
I learned that during all this. I didn't know that.
Who's had a health unit, you know. And we will look at that in the future if we need to bring on someone, because certainly what we've seen is that in Jefferson Parish, 25% of our people are over age 60.
Wow.
Okay, 28% of our people are African American, so that's two very vulnerable populations we have in Jefferson Parish. Many of those overlap in both of those groups. I think that's why you've seen our death rates in the African American population so high. You're elderly, you're African American, you're in both of these vulnerable groups. So that's the conversation that we're going to have in the future, and council members are talking about that as well, is what do we need to do about this? And so many seniors, how do we, so... But so our health department is Louisiana Department of Health. And unless I see something that vastly changes in Jefferson Parish that would make us have to veer off or be a reason for us to veer off from the state guidance that the governor's setting, we're not going to do that until we see something. And look, Jefferson Parish numbers are highest in the state.
Exactly.
But we're also one of the most populous parishes in the state. And we're
you're
testing.
Doing something right, because the numbers are leveling out.
The numbers are leveling out, certainly, and we watch the dashboard every day. But also, I think per capita wise in Jefferson Parish, we're testing at a much higher rate. If you look at testing that's going around the state of Louisiana, nobody's coming close to Jefferson numbers, Orleans numbers. I mean, it's just, I
Right.
think we're at like 48,000, over four,
Wow.
probably going to be over 49,000
Between the
easily.
two parishes?
Between just, no, just in
just Jefferson.
Jefferson.
Oh, okay.
Just in Jefferson.
Wow.
So, you know, I have my numbers here. Nationally, you're trying to test at a 2 to 4% of your population. We're testing at 11% of our population in
Wow.
Jefferson
Okay.
Parish. So when I say, and people said, Cynthia, the more you test, the more positives you're going to show. It's
Right.
going to look like you're not managing it well. I said, I don't care. I want to identify as many positives as we can, get those people to stay home, get those people to stay home from work. I don't care what the dashboard reads. Like,
Right.
identify those people. And we've been very, very aggressive. We've set up a Lario Center since, I think, you know, in March,
Right.
which
I
was one
remember.
of the first federal pilots. Orleans Parish got 2, we got 1. And I've fought to keep that site up the entire time. And just
Right.
recently, probably in the past 5 weeks, we've started closing on a Sunday, or for a holiday, we give them off. But every day we're testing at a Lario Center.
Still, okay.
And so that's
And
part of the reason why our numbers are so high.
Can everyone get a test, whether you have
Absolutely.
symptoms or?
Any Louisiana resident can go to a Lario
Oh,
Center and get
okay,
tested.
so you don't even have to be a Jefferson resident.
No.
You can be, okay.
Yes, and so, and again, you know, in far as testing, we've been so aggressive, and we've had incredible
Right.
partners with Ochsner and LCMC, and we're blowing and going, setting up these
Yeah.
mobile testing sites. I mean, right now, at this moment, after here, you know, we're going to go to Woodmere. Woodmere was
Okay.
yesterday and today, and if I could, Terrytown is June 4th
Please.
and June 5th. Johnny Bright is June 9th and June 10th, and New Hope Community Baptist Church on June 12th. So we're really
Okay.
trying to go into neighborhoods, into communities,
Right.
especially when we're looking at where's the zip codes that this might be creeping up.
Yep.
We're pushing it out there. So extremely incredible on testing. So that's why our positive numbers are high as
Right.
well.
Sure.
It's
that
like
makes
we're
sense.
identifying,
Yeah.
and especially the asymptomatic spread. You know, the asymptomatic folks who are spreading it. So,
Right.
yes.
So what have been the implications of Jefferson and Orleans having different rules that you've seen so far? Because like you said, Orleans does have its own health department. The mayor has been more restrictive than the state and is continuing to be.
There's so much back and forth between our parishes.
I mean,
and
the virus
certainly
can't tell where
the virus can't tell what it is. I think
you
it's
know?
probably just business owners who have holdings in different parishes have to
Right.
just be more, you know, involved in what's different in each parish. But certainly, you know, I respect Mayor Cantrell's decision for her parish, and you know, we're trying to do the best for our parish. But we're fighting and we're pulling for each other, and you know, the rules. It's more the business owners have to follow different sets
Right,
of rules.
right.
And you know, I've always said the whole time. I mean, I think there's been more. We have, you know, we're considered more the suburbs in Jefferson Parish. We have more of the big box. So, you know, it's always been my feeling that more of Orleans Parish throughout this has come to Jefferson Parish to do shopping.
Right.
So many of Jefferson Parish go to New Orleans. We love the great
Restaurants
restaurants,
and-
right? I mean,
yeah.
we all love
Right.
And the great.
Although if
the
you want to go to a bar,
boutique
you have to
shopping
go to Jefferson, not Orleans, at least in the short term, I guess.
in the short term. So I think, you know, Jefferson as a whole, because many of our retails and many of our big box have stayed open, have been doing curbside through phase 1. We attract a lot. We've always attracted, and certainly through coronavirus, we've still attracted many other people from other parishes, which I love. That's our,
Yeah.
that's our sales tax, right? Helping our
Right.
sales tax. So
You have
I
the
think,
Trader Joe's, for example, and Orleans
yes.
has the Costco. I
Yes,
guess.
exactly. And Trader Joe's, I think a lot of Orleans Parish people come to Trader Joe's,
Right.
which you know, I have a great history with
I
that
know you do,
property,
yes.
and I love it. So, you know, so
Uh-huh.
we have a lot of back and forth, but
Okay, let's get to some of the reader questions here. And a lot of them are about phase 2. A lot of them are about
sure.
how people
Next
live their
steps.
lives, as
Yeah.
you would expect, because everyone's trying to figure that out. A couple people asked about libraries in Jefferson. What's the
So,
status there?
so the governor just announced his, you know, yesterday afternoon announced that. So we are literally right now having those meetings and finalizing those meetings on our library, on our recreational systems, with so many programs. So I actually, I'm going to get updated at 3:00 today. We
Okay.
have a meeting to see, and I'm pushing all of our directors, and
Yeah.
there's over 40 departments in Jefferson Parish. And that's what was difficult as we were restricting it. How do we continue to deliver services, and how
Right.
do we protect our employees, and what this looks like at every phase as we went in the cave, I say, and as every phase as we come out. So what I'm looking for in all of our departments is phase 2 has got to look different from phase 1, because this is a gradual step out approach to getting us back to normal. So every phase has got to look differently. So right now, library services, and I want to encourage everyone, we've opened it up to everyone. Incredible online services at the library.
Okay.
I feel like it's the hidden secret that nobody knows. Just the amount of online services. We pay a lot for it. Thousands of movies, recipes, any kind of,
So
you
not
want to
just
learn the
things that
latest
you could
Excel.
check up. It's not something you can pick up curbside. It's something you can access online.
Everybody knows the website Linda to learn
Yep.
any kind of software available for you for free.
Okay.
And we've opened it up at the beginning. We said, maybe you don't have your Jefferson Parish Library card available. Maybe you're in another parish. Just open this thing up. You can just get online, get a temporary card. You don't have to be from Jefferson Parish. Get your temporary library card, and a wealth of services. Incredible, cute little books, children's books that are read, that are animated.
Oh,
I mean,
great.
just, recipes
Okay.
from around the world. So that's the mode we've been in.
And
so
that's just go to the public library website and you
go
can
to
access that?
jeffparish.net and go to the library website. And so that's the mode we've been in. And so now, what does that look different? How do we take that to the
Right.
next level? And so
Right.
we're going to hopefully make announcements, certainly by Wednesday or Thursday,
About the facilities
about the
themselves.
facilities,
Okay.
about all the recreation programs. We have a council meeting on tomorrow, so
Right.
I'm trying to get that finalized so I can make an
Pools
announcement.
people are gonna wanna know
Pools, we have
about.
one pool at Johnny Jacob Playground, and so I was just talking to our recreational director about it has to look different from phase one.
Yeah.
What is the next step into it? And so we're going to make all those announcements about our recreational. Now, summer camps are open. Baseball started. Baseball tryouts are going on now. So, and we're able to do that in a very socially distanced way. And
Are you
luckily,
able to serve as many kids as you could
yes,
before?
yes,
Right.
there are tryouts going on now at baseball, so we're not limiting that. And luckily, baseball's a big field; it's outdoors. So, I think they're kind of asking for tryouts just to have one parent come in. We know with the small children, try to do what you can to limit it.
Sure.
But certainly, the program is going to be running at full speed.
Great. Okay.
Yeah.
Because a lot of parents have had a lot of kids at home for a
Oh
long
yeah,
time.
please. I know.
Yes.
I know. Yeah.
This is a recreation-related question from Bill in Metairie. And he says there are a lot more people now using exercise tracks at all of the parks around the parish. And he's wondering if it would be safer to make them one-way, given the traffic. Any consideration to that?
We haven't really thought about that. We had the whole time have kept it open for the tracks. We wanted that. Now, one of the things in phase two is we've kept the bathrooms closed.
Okay.
The water fountains closed, just because we are down-staffed. We don't have, certainly we sent a lot of people at home, but with dealing with illnesses, we're not where we should
Right.
be. So I think in phase two, what we'll be announcing probably is that we'll open those restrooms, but we really haven't talked about the one way. And look, it's not a narrow track where it's,
Right.
you can't just, I walking on the levee, you just kind of veer off a little bit. So I think anytime you put a rule, it's almost like, how do you enforce the rule?
Right.
And then you have somebody complaining, and then you got to, my thing is, are we making more harm having a recreational employee come out and enforce something? That's another interaction that doesn't have to happen. Is it worth that? Is it
Right.
worth it for us to have that, conversation that might be a negative conversation? So everything's a balance with
Or
that.
have people
Yeah.
maybe have a negative interaction with each other?
Exactly. So I think, in theory, it's a good idea, but it's also easy just to kind of separate
Yeah.
yourself and continue
And
walking.
the guidance has changed over
Yes,
time on
exactly.
terms of outdoor risk versus indoor risk and
Yes.
things like that.
And it would require, us putting out signage, and,
Yeah.
it would be a lot. So,
Yeah.
yeah.
Tattoo shops, people are asking about.
Yes.
Open again?
Open, I think, right?
I
No,
think
no.
so.
Let's say yes.
I think under phase two,
Yes.
the governor said yes, with restrictions.
Yes.
So,
Yes, with those restrictions. That's one of the new ones. So the day
right.
spa, the tattoo shops, the
The mas-
massage shops, and,
Right.
and the estheticians. But certainly there's additional guidance with the Louisiana Department of Health
Right.
and the cosmetology boards on these kinds of things that
Right.
need to be looked at. So many of these industries have additional guidance.
And salons and things like that
Yes.
can have more people, can be up to 50% as opposed to 25%.
Absolutely.
Under the
Yes.
New, under the new
Absolutely.
guidelines.
Under 50%.
Okay.
And they're doing really well, I'm told.
Are they? Okay.
I got my hair cut, and, my stylist,
next
she had a
week.
mask on,
Uh-huh.
and but not a lot of people. She's controlling her appointments, so one person's leaving, one person's coming in.
Mm-hmm.
The shampoo woman was masked, so I felt very safe.
Good.
And
Okay.
applaud applaud all the industries who are ready, who know what they have to do to make their customers feel safe, because that's the business model too.
It is.
Right? I mean,
Right.
I'm on the threads with my friends, and they're telling us what stores to go to and what stores aren't
Right.
abiding by it. And I mean, these are out there.
And
So
you hear people, I mean, I'm this way, when you go to a place and you don't necessarily feel like they're taking good care of you, you might not want to go back.
exactly.
So,
Yes. And I was on the phone with Jerry Bologna, who's Jedco, and he's saying, that's definitely out there, is that, if you can show as a business you care about your employees, you care
Right.
about your customers, you will be rewarded in the marketplace.
I think so.
Yes.
That's capitalism.
Yeah, that is.
That's how it
right.
works, yes.
That's right.
This is a question we got in Orleans too, and you really feel for people who are planning weddings at this time. Claire in Metairie is getting married in October, and she'd like to know. I know she says, I know there's still so much uncertainty, but what do you perceive the situation is going to be in October regarding the number of people in churches and receptions and indoors versus outdoors?
So here was the thing. When you listen to the governor's press conference yesterday, he didn't speak about wedding venues, but if you go look at his
Yeah.
announcement, event centers and wedding venues are part of the 50%.
They are.
Yes.
Okay. 50%
50% of
total
of capacity. Right.
Okay.
So wedding venues are absolutely able to operate at 50% of the capacity, and certainly, with those social distancing guidelines of setting tables apart, and it's not probably the time to do your slow dancing for everybody, right?
Yes.
But I think with those variations, wedding venues can open at 50%. And again, that was on the governor's on his announcement on his
Right.
website.
And I don't think there was there an absolute number, do you know, of how big a gathering could be?
So, right, I think what we're looking at now, because at first with the White House getting criteria, it was like 10, and now it's 50. But if you
Right.
go in a store, you could be over 50. If you go to Costco
Right.
or Sam's, you're already over
Certainly.
50.
Yes.
So I think really what the guidelines now is certainly how big the building is, and 50% of that capacity from the fire marshal's office from that
Okay.
permit. And they all have that placard that shows them. And I think it's pretty easy to find. I know a lot of businesses didn't know, and it seems like they found that number very, very easily.
And they
So,
all have to register, I think, with the fire marshal's
Exactly.
office to open, so that information
yes,
would
certainly
be
some
available.
industries, yes. Mm-hmm. Yes.
Okay, here's a loaded question for you. If there's no vaccine, do you think you could safely have a full Mardi Gras with thousands of people in the street and on floats, especially if the virus becomes more widespread in the fall?
So Mardi Gras is a far time away.
It is.
How many, 8-9 months?
But people plan way ahead
People, and that's
sign
the
up to
problem. And I
ride
was
and-
contacted by some crews, and people plan way ahead, and
Right.
really they start when Mardi Gras is over. They start getting their contracts
Exactly.
for their floats, and
Sure.
they have to, and their membership. And I would hope, who knows? For Mardi Gras, I'm hoping if ever we needed a Mardi Gras, we needed a Mardi Gras after Katrina, and we
Yeah.
needed a Mardi Gras now. I mean,
Yeah.
right? In terms of what Mardi Gras means to us, what it means to who we are as a people, we need Mardi Gras. Certainly, economically, it means everything, but even more so, like Mardi Gras is who we are as a
Spiritually,
people.
we need it.
Spiritually,
Yes.
soulfully, right? We need Mardi Gras. So I'm
I
hoping
remember
we
your
can
dad
get
had
there.
a float with his,
My dad had a float. My dad loved
He
Mardi Gras.
invited me to ride on it one
Oh,
year, and there
wonderful.
wasn't enough room for me because of all
Oh.
the throws. So I hopped off.
Oh
Yes.
no, that's a terrible story.
It's
Stephanie.
fine. No, it was totally fine.
But no, he really loved it. He loved it as a kid, and he loved it coming up, and he certainly grabbed every part of it. But so I'm hoping we can get there. I certainly want that. And I'm just telling all the organizations, write your contracts, put it in your contracts that you put a qualifier in there that
Okay.
it depends on coronavirus. I mean,
Oh, is that-
so I'm
And then
not
are-
an attorney. I'm not
Right.
an attorney, but I'm just saying everybody, that's the mode we're in. If you can, whatever deposit you have to put down, or make your membership not be so financially exposed, understanding that there's
Right.
this give and
'Cause
take.
it's, a lot of people, there's unemployment is way up. A lot of business owners don't know what's going to happen. This is the time they need to be writing checks. If they wanna ride.
Exactly. And so certainly, there are some expenses that have to, costumes. People aren't going to want to make a costume unless they know they're going to get paid. So, I mean,
Right.
everything's kind of touch and go on that. But, proceed carefully
Okay.
with hope is the best we can say.
Okay.
Yeah.
Could you imagine Jefferson and Orleans not doing the same thing on Mardi Gras?
I would not want that situation to happen, because if one of us doesn't do it, the other one just is super crowded.
Yes.
So, you're already tinkering on the, you're on the brink of, can we do this
Yeah.
just with what we have? Now you're like iffy with double the capacity, almost like breaks the formula up, So I would hope we could
interesting.
move together as a region on that, and certainly have those conversations based on the medical advice that we're getting, because I would not want to see a situation where one of us doesn't have it or the other and makes the other one more crowded. I think that's just kind of a dangerous situation to get in.
That's interesting, yes. And you and Mayor Cantrell, you've been working on transit, you've been working on a lot of things together.
Absolutely.
And-
We've been working, and I ran on this, but we have got to have, our economies are tied together, and not just Jefferson, New Orleans, all the surrounding greater New Orleans area, right? Our economies are tied together. We have so many residents living in one parish, working in another, and so we have got to work together, because Alabama and Florida, that's our competition, not each other. It's these big companies going to other regions that I hate to hear about. So on that front, we have got to turn the page on that and understand that we're a strong region. For Louisiana to be strong, our region has to be strong as well, because we're an important region in this state. And let's start taking some of these big companies away from the other southern states.
This is a question from Rita in Marrero, and it's about a learning center. I guess that's a daycare center is what she means. I own a learning center in Marrero, and my understanding is Marrero is a hotspot. Obviously, the West Bank has seen a lot of cases for COVID. Should I open up?
So daycare was always a little confusing to me, because daycare is childcare, right? I mean, daycare is not just recreation, and summer camp is childcare. I mean, certainly my kids are older now, they're teenagers and older, but summer camp to me in the summer was childcare,
absolutely,
right?
yes.
So, I mean, I think, it's tied to the economy. It's tied to all of us being able to work if you have small children. So, I mean, there are specific guidelines for daycare, childcare operations that you have to, keep those groups separate, keep the smaller groups and the counselors or the teachers away from one another, and then go outside and not have everybody mingle. So absolutely. Look, Marrero, Harvey area was absolutely the hot spot when we were at our peak. And it's still we're concerned about it. But I wouldn't say that I think everybody's very cautious now. I think everybody's aware. So it was our hot spot. Our numbers are still high, but that's moving. And we were always reluctant to say what the hot spot was. Certainly we want to bring testing there, but we didn't want the rest of the parish, when we were ramping up, thinking, oh, that's just in that area of the parish, we're okay. Because that is not, in the medical community, was one of the reasons they were reluctant to say what the hot spots were, was because they didn't want the rest of the parish or the rest of the state to say, oh, that's not our concern.
Yeah.
So, but certainly Marrero and Harvey took a lot of the brunt of this.
Right. Again, you mentioned earlier that you have a large African American population in Jefferson, and it's been hit disproportionately hard. This is a question from Patrice. Will you pull together a core group to discuss barriers in healthcare for people of color? We need to see town hall meetings explaining progress or lack thereof.
So those discussions are already taking place, and I think on the public health front and the inequities and the inequality of that, it's beyond this virus. It's, if we look at the studies, it's, are African American people more on the front line of this? Are they more on the front line of just being more exposed with this virus?
Because of jobs they have?
Because of the jobs they have, right?
Because of service industry.
And we have to look at, how do we handle it on the public health front? How do we help that community, the diabetes screening, the high blood pressure screening? What do we need to do? CARES Act funding came down from the federal government. I spoke to my directors and said, we certainly have programs in the community that we push out, food drives and stuff, but let's reserve some of these monies for a conversation about new programs that we can try to really be a game changer in this area. So let's not, certainly we all need, there can be more food programs and more assistance everywhere. Let's not go spend all the money without understanding that we need some resources to be able to, with the public health community, like with the experts who know this. And I have members of my staff on those calls. I've been on some of those calls. What are the solutions? How we can make a difference? And that is certainly our work, some of our first work, along with the senior population. And, you know, that's all tied together with what we have to do. Because we have about, you know, nearly 30%, 28% African-American people in Jefferson Parish, 50% of the deaths. 50% of the deaths, okay?
And then a large Latino population too.
Exactly, and we were just had testing at the Hispanic Apostolate. So on that front, and look, when we came in office, that was one of the things we brought in a cross-cultural coordinator to say communities that live together, that have the same leadership, that go to the same churches, are we reaching them in all the pockets of Jefferson Parish? Do they know the resources they have in Jefferson Parish government? And that's the next level that we're trying to push in all the departments is, how do we reach those communities? So I'll bring up the Hispanic community. We just last week opened up a new text alert. You can text JP Noticias to 888-777. Certainly now with COVID, with hurricane season fast approaching, you know, that language barrier is critical.
Storm in the Gulf,
Yeah, I mean, and it goes quick. How are we reaching the people who don't speak English? How do they know it's time to evacuate? How do they know how to evacuate? What evacuation routes to take? So we certainly have strong partners in the media, in the Hispanic community. So we're really working closely with them. And we brought on a cross-cultural Daniela Bayo. She's been translating all of our press conferences for us. Our public information has been pushing that out. So again, that's that next level that we need to see Jefferson Parish going to. So we've been working on that.
And is this part of the conversation with whether Jefferson should have a health department, I assume?
Absolutely, it's all together. It's how do we reach people, and how do we take care of people with the resources we have? How do we do better on that? And, you know, the only good thing about coronavirus is that it laid bare some of those things that might have been right under our noses, but we didn't realize it, or we weren't talking about it, so it elevates that conversation. You know.
So there may be some changes coming out of this.
Yes, absolutely. We have a lot of work to do.
Interesting.
Yes.
Once we get beyond this period, this is a question from Brina in Metairie. I hope I'm pronouncing that correctly. And, you know, this is another frustration you hear from people who are being very careful when they wear masks and they look around and they see other people not wearing masks. Why are you not making it mandatory to wear masks? It's so important for not spreading the virus. Please, she says, please make it mandatory.
Absolutely. So this is one of those things that is, masks are very highly debated. Stephanie, when I saw you today, you had your mask on.
And you made this.
I make my masks. My daughter and I have started making them.
Multi-talented Parish president
No, but it's just been a good, easy, stressful break for me. But but I'm an avid believer in masks, and I push that. So again, I am going to rely on what the medical community is saying regarding masks. The CDC is having it be a recommendation. The Louisiana Department of Health is having it be a recommendation. I'll be honest, I wear a mask a lot. There are times where it's hard for me to breathe, you know. I mean, some of the masks I wear are like double-sided. One of my friends was just saying, if you wore the different kind of mask, it's just single-sided. I wear the masks that are double-sided. I have to pull it away from my mouth and take a breath. So
and then
I think
when summer comes, it's going to be
it's hard.
worse.
And a lot of times I'm outside, you know, even grocery shopping for a while, I have to like take a couple big breaths. So I think there's a couple of issues. There's, you know, people have to make the right decision for them, and I think the big issue is an enforcement piece. If you do it, how do you possibly enforce it? Do we make business owners approach people and enforce it? Do we make, and again, with the enforcement thing, and it's always in my head, in recreation, you're making somebody get up in somebody's face, say something kind of negative, or am I now creating like an even worse situation of people like getting angry and yelling at one another, and now they're respiratory droplets, like versus somebody without a mask who should be wearing a mask just passing me by in the grocery store, and they're not speaking to me and I'm not speaking to them. So again, everything's a balance, but at the end of the day, it's a medical issue, and we're following the guidance that the CDC and the Louisiana Department of Health have been saying. But I personally am always, you know, wearing a mask when I'm out.
What do you think of the way it's been politicized in some circumstances? And again, you're a Republican, and you know, there are some Republicans who have really made this kind of a, you know, a political which side are you on issue.
I have not looked at any of this politically. I mean, and if I did, shame on me. I mean, you know, I have, you know, April 2nd, I think, in Jefferson Parish, 745 was the number that greeted me on the dashboard that day, that I had to say 745 residents just got coronavirus, you know, within the past couple of days, and it appeared on the, shame on me if I think of any of this as political. I mean, this is about, and look, we will never know how hard we're working. Our team, you know, everyone, the council, everyone has worked so very hard because I just know that the harder we work, the death count is lower.
Right.
Okay,
And people
the
can
virus
draw
or
the
the
wrong conclusion from that. People can say, well, it wasn't that big a deal.
I know
And
in my heart of hearts,
yeah.
just plain logic, the harder we work, we kept this virus at a lower rate. And that's my work, and that's important work to do now. And politics just doesn't belong on my plate. If that's
Yeah.
a big enough, that's enough work for me to do right
Sure.
there, right?
Yeah.
So I don't want to weigh in on that, and I don't think it should be politicized, but certainly we have big elections coming up, and
Right.
it's difficult for the conversation not to go there, but that is nowhere on our plate in Jefferson Parish.
Okay. You. This is not a reader question, but I'm curious. You just came into office in January, so you really didn't have a lot of time to get your administration together, start the initiatives you were hoping to start. How do you think this will end up changing your administration?
So, Stephanie, we were in 9 weeks. Myself, the council. This
That's
is
right,
how
and you had a new council.
a new council. And then you figure you don't move until we're sworn in early January, the first January.
And then there's Mardi Gras.
And then there was Mardi Gras, but
Yeah.
there's a move that has to, like physical move
Physical
of
move.
office space, right?
true.
like
Yep.
so the first week is an actual physical move of all your files into a new office space. Then we had Mardi Gras. So this is how early it was. We reorganized the chart, the organization chart, and I put people into the departments, and we have over 40 departments, put people into clusters. I still have not had some of those first meetings with some of those
You're kidding.
clustered
Wow.
of where are we going to take this in the next 4 years.
Right.
Start telling me concrete items that we're going to
Yeah.
achieve in the next 4 years that I'm going to hold you accountable for. I haven't even had like 12 of those meetings yet out of
Wow.
over 40 departments.
Okay.
One of them was sitting right there. Our land use committee, they were waiting for me. I was late for the meeting because the governor's office just called me on the 9th and said, you got the first case in Louisiana. It's in Jefferson Parish. That was my introductory meeting with that
Wow.
cluster.
Okay.
So that's how early we
So
were. Because
land
of course,
use was not on your mind that
land
day.
use was like, I'm sorry, and that was delayed.
Yeah.
That meeting was
And
delayed
that
for
was
another
a
reason.
big issue you ran on. of
Exactly,
course.
exactly. So that's how early we were into our administration. Is that I never had some of those initial meetings with some of those departments. You know,
Okay.
I certainly know all the directors.
Sure.
We wanted the directors to be on our team, but that even first conversations about what are we going to do in the next 4 years. Let's start putting this down on paper. We didn't even get to have yet. So that's how early we were into this. Now, nothing solidifies a team like coronavirus, right? Gretchen Hurt, our new public information
Right.
officer, on the forefront of this, brand new to our team, not knowing anyone, not knowing
It's like going through a
directors.
hurricane, I think, for a
It's-
newsroom. I
yes.
mean, nothing breaks down barriers like that.
And, so I feel like you come in, you run a campaign, you come in, you're excited, you're new, and you're on
You
the
know
offense.
exactly what you want to do.
Yeah, that's offense time, right?
Right.
You get a honeymoon period
Yep.
for everybody to kind of let's see what she can do, let's see what the council's going to do, and
You had a big victory. People,
exactly.
were
And so
excited.
there's an excitement, and then
Yeah.
now it's like. Since then, we've only been playing defense. And I'll say that, like, I can't wait to start having meetings again on how to take the parish to the next level. But it's like, oh, really? Are we just going to have to keep clawing our way out of this, clawing our way back to a stronger economy? So we're going to do our
Right.
best at regaining our footing. I'm hoping the economy comes back with a vengeance. We are all looking forward to a trip. We're all looking forward to travel.
Right.
I hope our restaurants, our small businesses, everybody get back up to speed and we can regain our footing. But again, the public inequities, great way to play offense of what
Sure.
what changed for coronavirus, right? Our seniors, what are we going to look at for? So it brought in new issues that we're going to have to make
Right.
some real progress on.
Okay. But the day you get to sit down and talk about land use is going to be a really good
It's
day.
a good day, right?
Yes.
It's a good day. I had a meeting about transit. I participated in a Zoom meeting on all, and that's one of the regional things we're looking at, transit. And I was like, how nice to be talking about transit and, maybe reimagining, which we're doing now, new transit lines and how to make it better for us. So that was very refreshing,
I wanted to switch gears a little bit. This is obviously coronavirus is the theme of this, but the news never stops. And we've had, I'm sure you've been following the news nationally and locally about George Floyd and the police shooting in Minnesota and the protests. And we actually got a number of questions which were off topic, which were about um, the Jefferson Parish Sheriff's Office does not require body cameras. And again, I understand you don't oversee the Jefferson Parish Sheriff's Office, although you have some ties to some history there, obviously, and you're close to Joe Lopinto. I'm wondering if you could talk about like that specifically, and also just the issue in general. What is happening in our country?
I can't talk about the body camera specifically. I've never had a conversation with them, and I'm
Okay.
not well read on that issue.
Okay.
So I'd hate to broach that subject because I don't know the reasoning there. I'm happy to talk about the George Floyd issue. It's heartbreaking watching what's going on in the country that we all love. It was heartbreaking. I saw much of the video of George Floyd, and then I was able to get the longer video piece. I think it was a 6-minute piece, and that was just heart-wrenching. I can't imagine how that could happen. It was one of the worst things that we've seen. Watching a man die under the knee of a police officer in broad daylight with everybody screaming and yelling like he's dying. Like, how does that happen?
Right.
And I think we need to understand how that happens. It wasn't just one man's bad decision. It was 4 officers' bad decision. The conversation needs to be, how did this happen? What is there? And how does it never happen again? And that's not what the conversation is right now. The conversation is about what store is being looted and what's on fire and who's causing this. And the real work on making us better as a country is not taking place at this moment. It will take place. And I think we were just talking. I come from a unique position because I was a federal law enforcement officer. My father was sheriff for 27 and a half years. People I love, people in my life that I truly love dearly, very close family members to me, are with the Jefferson Parish Sheriff's Office. I have that perspective. I understand what it's like, for them to feel dangerous, to go out and be called into a situation where they know nothing what's greeting them, how many guns are going to be there. They want to go home to their families. They have loved ones, I also understand the other side of the situation and deep-rooted, not to the extent that a black man would understand it, but I've also had the experience of someone looking at me with hatred in their eyes for no reason, just because I'm not the same color as they are. And that's not what this is about. I mean, I understand that racial divide in some of those conversations and the mistrust. Exactly. And and I'm not saying that's in any way what happened in this situation, but I do understand that minority general perspective, right? Growing up, I was the only Asian student in an 800-plus school. So I don't understand it in the perspective of being a black man, but I kind of understand it from, we all have our life perspective. There's a lot of sadness. It doesn't look like sadness. There's a lot of fear. I think there's a real fear about black men being approached by police. Okay, let's put it this way. If I'm stopped by a policeman, even if I wasn't the parish president, I'll tell you, Stephanie, and you might feel the same way. Do you have a fear for your life?
I do not.
You do not have a fear for your life.
And I am very aware of that.
You're gonna say, I'm being stopped. What did I do? Even if I did something wrong,
I'll make my case.
I'm going to make my case. I'm going to fight it another day. I'm going to hire an attorney. I'm going to see this in court. That's what's on my mind. This is an inconvenience. Why is he stopping me? I really believe black men feel like if they're stopped because of these extreme cases that are replayed over the media, I really feel they have a fear of like, George Floyd is going to happen to me right now.
Absolutely.
Okay? So,
and parents have that fear about their children. Absolutely.
Parents have their fear about their children. Mothers have that fear about their children. And gosh, forbid, if there's a gun on the scene and they are thinking, this is the fight of my life, and then they go pull a gun, like that whole situation is getting further and further away of what needs to happen. Thousands of policemen have to encounter thousands of people of all different races on any given day. We need them to for an orderly society. And what we need to happen is everybody comes out alive at the end of those encounters, right? Everybody comes out alive. And the two extreme situations is what happened with George Floyd and which happened with Modesto Reyes in Jefferson Parish are the different cases of how that didn't happen, that lives were lost at the end of those two encounters. Very different reasons, okay? Very different. They're not the same cases. but two extreme examples of how this can go very, very wrong, okay? And so it's a deep issue. There really needs to be a conversation. There needs to just be some trust. And it's the hardest situations you're watching of like in America that I don't even recognize, the looting and the fire. And then the couple of situations yesterday, which were the most beautiful situations in America of a sheriff or a chief of police hugging, holding hands with the protesters.
Right. There was a video out of Shreveport of an officer and a young
And
man.
isn't that the best of who we are, of opposite sides, and saying, I still respect you as a human being. I love you. We're both hurting. I'm going to hug it out. That is the bridge that starts a conversation to make it better, that these incidents don't keep happening. That is the healing that needs to take place. And the violence and the lawlessness is just the complete opposite of what needs to happen on this issue.
Right. Do you see the parish, obviously, again, unlike Orleans and some other places, the law enforcement does not report to the parish. Law enforcement is separate. But do you see the parish, your office, being involved in this?
Well, we're involved in it in that it affects everyone. I'm certainly not involved in it. We have a strong sheriff. But look, Sheriff Lapinto has a good working communication with the community, all members of the community. And he's been very good at any incident happening, letting the media see what happened, reaching out to the community, explaining it, so that dialogue is there. So when things happen, there's an understanding, there's a trust there of our police department. And I think Jefferson Parish, we're a very diverse parish, okay? But there's a trust that our sheriff has done with the community to say, if punishment needs to be made, I'm going to make the punishment. If the police officer didn't do anything wrong, here's the video footage, here's what it is. And we have to, unless we see some wrongdoing, we have to support that because we're not that way in Jefferson Parish. And our sheriff is really communicating with the community. Our police officers communicate, and we care. I mean, I know these police officers. They care about everyone in the community. I would hear it if it wasn't the case, because I'm friends with these people. They care about every single person in this community. I can say that from the bottom of my heart. I mean it. I know these people. And they put themselves at risk for anyone's life in this community. So hopefully none of this bleeds over to our area. It shouldn't, we're not, but we don't want anybody from out of area coming and inciting and agitating what we believe is a strong community and strong working relationship with our sheriff's office.
Thank you. We're running out of time, and before we end, I just wanted let's switch back to coronavirus. I know that was a very heavy topic, but looking forward, what are the next things people should watch for?
With coronavirus?
With coronavirus and with reopening in Jefferson.
So, again, every business, all of our departments, everybody is preparing for phase 2, and this is some big, heavy lifting we're all doing. It starts Friday, and still don't let your guard down. It does not mean that if you are a vulnerable person, if you're an older person, if you have someone who has a sickness, it's still, who cares if the rest of the world is going into phase 2? It still might not be the right time for you to venture out, or maybe you do a phase 1 now when everybody else is doing phase 2. I mean, but it's still going to be more crowded out there, but you limit your action, or you, so
use
again,
your judgment.
Use your judgment.
I mean, the governor said this. He said, this doesn't mean I can't guarantee everything that's open is safe. He said that.
Right. And so I know there's still some restrictions, and, the nursing homes are still extremely vulnerable areas for us. And, visitation is hard. I visited someone in a nursing home for a very long time, and that was, that needs to happen, but certainly it's very vulnerable just given the age of the people, the sickness of the people, and everybody confined in a smaller space. That is our most vulnerable areas, and we've seen the death follow in there. We've had 15 it's affected 15 of our nursing homes in Jefferson Parish. So it's not right for everybody. But, please understand the virus is still here. And please don't act like it's not, because that's disrespectful to everyone who lost a loved one, everyone who was sick. So we're just pleading with everybody, let's do this and let's be successful, understanding that the virus is still here.
Okay. Well, this has been great. Thank you so much for joining us.
Thank you, Stephanie.
And interesting conversation, as always. And thank you all for joining us. We want to thank you for supporting our journalism. It's never been more important than right now. And again, thank you for subscribing for those who do. If you don't, we'd like to ask for your support today. It's easy and affordable, and you can do it at NOLA.com/subscribe.